Okay, right. Hello everyone. I'm Councillor Maria Crompton, Deputy Leader of Sandwell Council. This is my first meeting of the Sandwell Health and Wellbeing Board, so hopefully it will go without a hitch and we can crack on and do everything. I've got a bit of household stuff to do first, so I've got to read this out. So welcome to the meeting of the Sandwell Health and Wellbeing Board. I'm Councillor Maria Crompton, Statutory Deputy Leader and Chair of the Board. In accordance with the 2020 coronavirus regulations, this meeting is being held virtually to facilitate attendance and enable the consideration of important matters during the COVID-19 situation. The meeting will therefore operate differently in that members of the board joining in remotely are still able to contribute and vote on any matter. I would ask for all attendees tuning in to mute their microphones unless they have been invited to speak. I would ask that if anyone wishes to ask a question or make a comment, please use the hand rise symbol if you have one, or type a Q in the message. Well, I've not that one before. I will invite you to turn on your microphone at the appropriate point. When you are finished speaking, please remember to turn off your microphone. Please note that this meeting is being live streamed via the Council's website and will also be available to view by members of the public and the press who are allowed to, by law, film, audio record, take photographs, blog or tweet at this meeting. Before we start, David Stevens will ask each board member and officer present to introduce themselves in turn. David, if you could do that, please.
Okay, I'm going to run off the list. Alexa Farmer.
David, it's John Taylor, Chair of Health Watch. Lexia's here to support.
Okay, thank you. Chris Guest. Chris, is your mic off? Okay. Claire Norton.
I'm here.
David Carruthers.
Hi, Dave Carruthers, Acting CEO, Sandwell West Birmingham Hospital Trust.
Thank you. Deb Ward.
Afternoon, everyone. Deb Ward, Operations Manager, Sandwell Safeguarding Adults Board.
Councillor Shaheen.
Councillor Father Shaheen, Cabinet Member for Living Healthy Lives.
Marsha Foster.
Hi everybody, it's Marsha here, struggling to get off mute, I do apologise. I'm from Black Country Healthcare.
Thank you. Francis Craven.
Hi, Francis Craven, Chief Executive, Sandwell Children's Trust.
Thank you. Ian Green.
Hi, Ian Green from Westminster Police.
Ian Sykes.
Hello, Ian Sykes. I'm a Sandwell GP and I'm Chair of Sandwell West Birmingham CCG. Thank you.
Thank you. John Taylor.
Oh, I've done that. David, John Taylor from Health Watch.
Yeah. Councillor Underhill.
Hi, Councillor Joyce Underhill, Cabinet Member for Best Start in Life.
Councillor Alcock.
Councillor Keith Alcock, Cabinet Member for Home.
Leslie Hagger.
Hi everyone. Leslie Hagger, Executive Director of Children's Services at the Council and Chair of the Children's Safeguarding Partnership.
Okay, we've got Alison Knight.
Hello, I'm Alison Knight, Executive Director, Neighbourhoods.
And while we're still in the room, Stuart Lackenby.
Stuart Lackenby, Director of Adult Social Care.
Thank you. Lisa McNally.
Hi, Lisa McNally, Director of Public Health for Sandwell.
Mark Davies.
Hello, Mark Davis, Chief Executive at SCBO, Voluntary Sector Umbrella Organisation.
Thank you. Michelle Carolan.
Hi David, Michelle Carroll, I'm Managing Director for Samwell across the Black Country and West Birmingham and the CCGs.
Thank you. Paul Mosley.
Hi David, yes, Paul Mosley, Sandwell Better Care Fund Programme Manager.
Shane Parks.
Yes, David, I'm here, Democratic Services Officer, and I'll be clerking the meeting tonight.
Thank you. And Stephanie Hancock.
Steph's actually live broadcasting today, so she won't be able to answer
thank
today.
you. I think I've just got Dr. Ahmed in the lobby, so we're just going to let Dr. Ahmed in. Dr. Ahmed, are you in the call? Okay.
I can see 9 Charles down there as well.
Okay, and I can see that Elaine Giles has joined the call. Councillor Giles? You're on the call, Councillor Giles? Okay, I'll hand back to you, Chair, because as people are coming in, I'll probably be at this all night if I'm not careful.
Yeah, okay, no problem. I think that's probably the best thing to do. Do we actually have any apologies?
Yes, Chair. Okay. We've got apologies from Mark Axel, but I believe Marcia Foster's here to represent him. Toby Lewis, David Carruthers is here, and apologies from Councillor Priest.
Okay, that's lovely. Thank you. Members to declare any interests and matters to be discussed at the meeting. Do we have any members to declare any interests? No? Okay. In that case, we move on to agenda item 3, the minutes of the meeting held on the 11th of June. Have we got any? Sorry, have we got anything to raise at that, or is there any objections raised or anything? Dr. Sykes, can you move the minutes to be agreed? Are they correct record?
I've had a look through them and I'm happy to approve the minutes as long as all those in attendance are also able to. I'm happy to do that, but yes, I'm happy to approve the minutes as a true and accurate record. Thank you, Chair.
That's lovely, thank you. Everyone else happy? I'm presuming they are. No, nothing coming back. Okay, lovely. In that case, we will move on to agenda item 4, which is the main business of the meeting. Okay, so 4.1. Why haven't I got 4.1? Okay, okay. 4.1. We've got the COVID-19 Sandwell's position, and Lisa, I think you're going to present that for us, please.
Hi, Councillor Crumpton. Yeah, so I will just share my screen with you. Okay, so hopefully you can see those slides, and I will keep it looking on.
We can't see anything yet, Lisa, I'm afraid.
Can you see it now?
Not yet.
Okay, let me try again, sorry.
You were nearly there, I think.
Can you see that now?
Yeah.
Yeah, that's better.
Okay, so. Sorry, the system's working very slowly for some reason. So what we've got there is an overview of the last 7 days of cases, and really what it seems to portray is a steady flow of cases over the course of the last 7 days. I would view those latter days with some caution because the labs nationally under so much pressure at the moment that we that those days will fill up as more data comes in. So we're seeing a steady flow. Comparing this week to last week, you can see that last week we had 314 cases. At the moment, this week stands at 295, but I expect that to go up slightly. But overall, week on week, we are seeing a significant rise in cases. And if we compare just those daily totals, you see they range from, say, 50 generally up to 60 cases, between 50 and 60. It was only 2 or 3 weeks ago that we were seeing 20 cases a day. And only a fortnight before that, we were seeing 10 cases a day. So like the rest of the Midlands and most of the Northwest and most of the Northeast, we've seen a sharp rise in COVID cases over the last, I would say probably the last month, we've really seen a sharp rise. Currently, Sandwell is around the 30th highest area in the country, which just goes to show that even though we've increased by what looks like about 500% in just a few weeks, actually other areas have increased even further. So we've got a problem, but that problem is part of a much, much bigger issue across the country. Moving on, if we break it down by town, we can see that Smethwick does remain our highest case rate, along with West Bromwich. Those two tend to consistently be at the top, and in particular, if we look at Smethwick, it's the areas that border Birmingham, and also apart from West Bromwich town, it's areas like Newton that also border Birmingham and the very east side of the borough that we tend to see the highest rates. In contrast, you can see Rowley Regis there over on the west side of Sandwell has consistently been in the 2 lowest infection rates for Sandwell. So that's a fairly consistent pattern. The pattern has remained the same. The scale has increased. And you can see Rowley Regis there has a rate of what equates to 46 per 100,000 population, 46.8. That would have had it at the top of the table only a few weeks ago. So a big, big, very concerning rise along with the rest of the country, or certainly the North and West and Midlands. In terms of a further breakdown by ward, you can see there that St Paul's and Soho and Victoria are consistently our highest scoring areas, along with Greeks Green and Ling and Smethwick. So those areas tend to be those areas with the highest rates. And I just wanted to show you this as well, because there has been a lot of speculation, hasn't there, recently in the media about so what does a case mean? What does a positive case mean? A lot of skepticism, a lot of misinformation out there, unfortunately, about whether a positive case of COVID-19 is an issue. Well, yes, it is. And there's a lot of misinformation about how somehow the virus has mutated into a less dangerous pathogen. Absolutely not. No evidence of that. And this graph really shows us a good example of the rise in our region, the Midlands region, in the use of ventilator beds in our hospitals. We're looking at, what's that, about a 400% increase in just 3 to 4 weeks. So it's a very concerning picture in Sandwell, in the West Midlands, and indeed across whole swathes of the Midlands and north of England. In terms of what we are, our response, of course, our response continues to be trying to rise to the challenge at every time. So the first thing we've done is, because we've had a large amount of demand from schools to our outbreak response team. Our outbreak response team runs 7 days a week. What we've set up is a dedicated schools team with the brilliant help of Leslie Hagger, our DCS, and Chris Ward, our Director of Education. We now have a dedicated hotline for schools, and that actually starts operating from 7:30, because you can imagine a lot of the issues the head teachers are faced with happen at that time of the day. They'll have a phone call saying, we've had a child test positive in this year group, what should we do? So the schools, judging by the feedback on social media and into us directly, are very, very grateful for the support they're being offered now. And just for me, I think the schools, the head teachers are doing an absolutely awesome job, because we can't take chances with schools. A large outbreak in a school not only potentially affects hundreds of children, but also the households that those children live in, and therefore the whole community. We're also starting a much more hard-hitting campaign, excuse me, which is designed to cut through some of the apathy that maybe we're seeing recently. The campaign's entitled, Is It Worth It? And it's going to really start to highlight some of the real consequences of infection and COVID-19. In addition to that, we've had a letter going to all new cases that is going to point out the new regulations, the new possible fines that government have introduced, and support to help people self-isolate. And finally, on our contact tracing, we've trebled the number of staff operating on the outbreak response team and the contact tracing teams. We're now reaching about 85%, which obviously has come a long way from the summer, when we were seeing much lower rates with the national test and trace system. And we're also stepping up our doorstep visits to try and reach everyone who really needs that information when they test positive about what to do, what not to do, and how to keep themselves and their family safe. So I think that's probably it, David, for me.
Thank you, Lisa. Have we got any questions from anyone? No hands going up. I mean, obviously we've got some medical people here as well, and this worries the life out of me. I don't know whether I'm just in my innocence thinking that it's worse than it is, or whether it is exactly as it is. I don't know whether Dr. Sykes would like to just make a comment on that to either reassure me or not, as the case may be.
Well, the first thing I would say, thank you very much, Chair, is that I would agree absolutely with all that Lisa said. I think one of my concerns is there have been comments coming out, and they're certainly coming out from some medical people within Birmingham about actually things aren't quite so bad. It's the young people are getting it and they don't get it too badly. The problem is the young people do get it and they probably don't get it very badly, but they're certainly very, very capable of spreading it to our vulnerable people who really can get it badly. The good news is at the moment that primary care is pretty well set up to deal with it. Fortunately, we're not getting huge number of cases yet in primary care, and I don't think we're getting huge numbers of cases in secondary care, although David may contradict that, but the cases are definitely going up, and I think it's really important we take this very seriously. Cases are rising. We know they're also rising now in the over 65s, and it's absolutely right that we take this very, very seriously. COVID can be very serious, and it can kill people, particularly those vulnerable people, and we have plenty of those, and it's absolutely right that we take that we take this very, very seriously. This is not a mild infection. It certainly hasn't gone away, but we can do everything we possibly can to protect ourselves and therefore the reduce of it being spreading. So I absolutely agree with everything that Lisa said, and I'll stop there. I suppose the only thing on this open call is to say that within primary care, it's important that surgeries are all open virtually. However, your own surgery may not be open physically. And that's in order to make sure that our vulnerable staff are being protected. So you may be directed to a nearby surgery if you need a face-to-face appointment. But if you do need a face-to-face appointment, you'll be offered one. We also have our Red site. This is actually based at Aston Pride within the West Birmingham area of our CCG, and that's to provide a very secure environment where those patients who do have COVID or are suspected of COVID can be seen safely and efficiently. And that's to make sure that we're reducing the risk both to staff and patients. So a brief update there. So it's not having it's having an impact, not a massive impact yet on primary care, but it's absolutely right. We take this very, very seriously.
Thank you very much for that, Ian. David Carruthers, did you want to add anything in there at all?
Thank you. I would certainly support that. I think in hospital we're certainly seeing more cases both presenting through D, but also requiring admission to hospital. But what we're really trying to do is work really hard to make sure we have separate streams for patients with COVID symptoms and those who have non-COVID symptoms, and also keeping areas of our hospital very much COVID-free areas so that we can carry on with routine services as well, because there was so much that got suspended during the first surge. So I think the message is very much that Lisa and Ian have said that we do need to take this seriously. We need to make sure that we're all following infection control procedures as advised, and reducing the risk of spread of the virus, because with those vulnerable people and elderly people, it will have a knock-on effect. And what we really want to do is keep reassuring the public that we're coming to AED if you don't have COVID-related symptoms, and you need to. It's still the right thing to do, because we're separating patients who are coming in with COVID and non-COVID symptoms, and also to keep attending for any diagnostic tests that they might have planned, or any outpatient appointments that require them to be seen face-to-face as opposed to by telephone. But we're working really hard to make sure the risk is minimised within the organisation when anybody attends for appointments for other care-related problems, which would really encourage them to keep attending. Thank you.
Okay, thank you, David. Thank you, Lisa and Ian and David, for that. I'm sure that the general public will hopefully take note of that, and we will continue with our strong messages going out. With that, I'll move on to agenda item 4.2, which is to update the community on the community engagement board. And I think Alison Knight, you're going to present that for us.
Yes, thank you. I'm presenting this item as I've been leading the community engagement and communications cell internal to the council, which sits under the incident management team. And this is really just confirming something that was brought to the Health and Wellbeing Board last month. It's we are now setting up a Health and Wellbeing Board, and many people around this table hopefully will have been invited to that. We have the first meeting a week Friday, so the 9th of October, and we will be circulating an agenda by the end of the week. The meeting itself, as you can see from the report, is something that has been requested really that we set up as part of our work on COVID-19, and it really is to make sure that we're engaging with wider partners from different organisations around the way that we're engaging with the community. So it will be chaired by Councillor Iqbal Pada, who is the portfolio holder for community engagement, and will clearly have the relevant portfolio holders on there, as well as others from the NHS, the voluntary sector, Health Watch and the police. So this is really just to confirm that. As I say, we're just putting the agenda together now with relevant updates, community engagement, further work that we might need to do, and also how we're sharing data, I think, has to be a key item that we discuss next week. So I don't know whether anybody's got any questions. Clearly, you've had the report sent out. Any questions from anybody? Well, look forward to seeing you all at the first meeting at the end of next week. Thank you.
We move on then to agenda item 4.3, which is Sandwell Safeguarding Adults Board Annual Report, and I think we've got Debbie Ward to present that for us.
Absolutely.
Yeah.
I should just be doing a very quick overview of the content of the report. I would like to comment on what difficult times it is to be reporting retrospectively on safeguarding activity. So you've all had the papers. So just as a reminder, this is my overview of the annual report 18-19. So what feels like a lifetime ago now, I'm sure, to us all. And as I said, we're in a very different world. So I want to focus a little bit on some of the key achievements of the board. I think it's important to say that The production of the annual report is a statutory function of the Safeguarding Adults Board, and as part of our work towards effectiveness and delivery during the reporting period, the board has undergone a refresh and is now smaller in terms of membership, but has more senior officers making up that membership. Again, we've worked with data colleagues to look at what our performance data is telling us, and try to link that to the activity within subgroups. So again, during the reporting period, the data was telling us that the highest location for abuse within the borough is an individual's own home, and that links to formalised support and also family members. And given our current circumstance, that still remains an issue. So there's an extra, if you like, concern around the impact of hidden harm when we're talking about adults with care and support needs. During the reporting period, 97% of people were asked how they felt and whether they felt safer, and 91% of those people said at that time that they felt safer directly as a consequence of the support provided to them. So I do think it is important to hold on to that, albeit retrospective, but a piece of really good news. Supporting the work of the Safeguarding Adults Board, there are 3 subgroups. So I just want to focus a little bit on some of the achievements of those groups. So the Quality and Excellence subgroup led on the development of a self-assessment tool, enabling partners and organisations to undertake their own assessment and rate themselves in terms of where they felt they were in relation to safeguarding, in terms of a range of specific areas. Examples including safeguarding leads within organisations, policies and procedures within organisations. And that piece of work was actually adopted across the West Midlands region. So actually all the boards now participate. So all 14 adult safeguarding boards within the region participate in a every other year process of undertaking that self-assessment activity. So again, I think in the light of everything, that's a really good piece of news. The Safeguarding Adults Board also, or the business team, also appointed a specific development worker to look at engagement and how we pick up on key messages that either frontline workers or people who use services are telling us, and how we ensure that that is threaded through as a golden thread, if you like, in terms of the work of the board. At the time of reporting, she was new in post, but her work is being built on and developed, and you may hear about that later on or early next year. In terms of the protection subgroup, they commissioned a safeguarding adult review and looked at the learning that underpins that, again within that reporting period. For the prevention subgroup, they've looked at developing stronger links with the third sector and developed a trainer programme to build capacity in delivering safeguarding training across a range of systems. And they also held a stakeholder conference a long time ago now that was well attended and really positive. So the priorities for the board at that time, and actually they still stand, is to listen to the voice of frontline staff and people who use services, develop an inclusive data set, look at referral pathways and people's understanding of safeguarding, do lots of project-based activity, and be clear about governance arrangements. In terms of regional work, and I think it's important to share that and understand it, the FSAB and members of the board have led on many pieces of regional work, including chairing the West Midlands Safeguarding Leeds Group. And I think that's important because it ensures that Sandwell is at the forefront of work taken and benefits too from the experience of our partners. And that's it from me.
Thank you very much for that. It is very reassuring that that this is still valid. A lot of the stuff in here is still valid at this point in time. And I'm sorry, Deb, that it was actually deferred for a few meetings before it actually got to us, because it's as you say, it is well worth noting now. And thank you very much for that. Appreciate that. Has anyone got any questions?
There's no hands up, Chair.
No? Okay. Thank you then, Deb. We'll move on to agenda item 4.4, which is the Better Care Fund and COVID-19 Section 75 agreement. And I believe that it's, is it Chris Guest or Paul Mosley, or both of you that are going to be presenting on that?
I think it's both of us. We're doing a joint effort tonight, if that's okay, Chair.
That's fine.
Good evening.
You go ahead.
Thank you. So good evening, everyone. I guess we just wanted to use this as an opportunity to share some of the work that the BCF team have been doing through this COVID pandemic, and also to share the changes that we're making to our Section 75, which is our budget that we actually have with the CCG. So we wanted to just start tonight, if we could, by just giving a bit of a background to the BCF for anyone who might be new to the meeting. Don't know if Claire, you can move the slide. Oh, thank you. So really, the Better Care Fund was actually created to make sure that health and social care services work much more closely together. And part of the way that we do that is through a pooled budget via a Section 75 agreement. And this is all about how we can address some of the issues that vulnerable society are actually experiencing, and how by actually pulling together we can make a difference by putting effective and sustainable services in place. So just to run through some of the successes when the slides catch up, and we're obviously in a bit of a slow tonight. I'll carry on and you'll catch me up, I'm sure.
Chris,
so
I think we're having
share some of the
we're having some problems hearing you, so you might want to switch your video off so that we have a better connection. If you switch off your video, we might be able to hear you a bit more clearly.
Okay, is that better?
It is, yes.
Okay, thank you, Claire. So some of the successes, and these are, and I've linked these to the requirements of the Better Care Fund programme about the high impact change model. But I think just to summarise some of the things that we've been working on recently, we always focus on choice, but I think it's always fair to say as well that because of COVID, some of the choice options that people have been restricted as we've prioritised moving people through an acute hospital setting as soon as they're medically fit to actually leave, to limit the effect of the infection control issues that they may be exposed to there. We're always committed to early planning and discharge, and particularly of working with our voluntary and community sector to ensure that people get home in a timely way. We've had 7-day services for a while across health and social care, but what we've done through this period is actually extend our COVID response to a 7-day service. So we have a COVID resilience team that covers 7 days. Trusted assessors have been established as part of the work that we do and partners that we work with. And what they actually do is make sure that providers don't have to go into a hospital setting to do an assessment on a person who's waiting to be discharged. So that helps to support the infection prevention agenda, but it also takes some of that burden off providers and allows us to step people down from hospital, be that to a hospital, a home-based placement, or of a community bedded placement. If we move over to the discharge to assess, this is all linked to the home first priorities that are coming down from the government, and a focus on supporting people to be discharged and be assessed in the community rather than be assessed for their long-term care needs within a hospital setting. And this is a real major piece of work that across the whole health and social care sector we're pulling together to deliver at the moment. We've also introduced systems, live systems, that allow us to monitor the capacity that we have in our community beds again, so we can move people through that system and maintain our flow effectively. And although MDTs, multidisciplinary teams, are in place, we need to enhance the working of the MDTs to support our discharge to assess aspirations. So that's a real focus again of the work that we're doing. And I just want to highlight the work that we've been doing with care homes in Sandwell. And what we've been able to do is, although we've lost some of our residents, which is always very sad, we've actually had significantly less deaths in our care homes in Sandwell than some of our neighbouring authorities and nationally. So I think by working together, we've proved that we can start to make a real difference to the way that people are supported within some of our residential settings. The next slide looks at some of the work that we've been doing primarily around supporting the COVID effort. And I think it's fair to say here, this is a whole system approach. So although the BCF team have made a significant contribution, we've been working with people across the council, with public health, with our partners in the CCG and Sandwell and West Birmingham Trust, to make sure that we've got a real coordinated approach to supporting the community and our providers through this pandemic. So I've touched on the COVID resilience team. They operate over a 7-day period. They take calls, they take messages from providers, they respond to queries. We prioritise access to PPE, and that's been very much appreciated by our care providers in Sandwell. When we look at the PP, if we just go to the bottom of that slide, what we've been able to do is to respond on the same day to provide an emergency supply, but also to put in a system that makes us clear what the demand is and what capacity we have to actually respond to that. As far as IT support is concerned, we've set up a system whereby we can support care homes to complete the national tracker. That's a requirement that they do every day. And what we've achieved is a 97 to 100% success rate and engagement rate with our providers on that. So that's been a real success. And we've also been able to support them to access NHS Mail, so we can share some of those key messages across the whole system. We're doing a combined effort as far as our communication with providers across Sandwell is concerned. So we have a joint newsletter that goes out from the council, which includes public health information and information from our CCG that we jointly approve, that covers all of the government guidance that's coming down, and we ensure that we try and interpret that in a way that providers can understand, and we get those messages out really quickly. And finally, with regard to infection control, the government has made significant funding available. The BCF team has been critical in coordinating the distribution of that, the monitoring of it, and the returns that are required for it. And we're now in the position where we're expecting another tranche of money. We'll continue to do the same with that further resource as it becomes available to the council. I'm now going to ask Paul to just pick up some of the issues around our Section 75 agreement, if I can. Paul, are you there?
Yes, thanks, Chris. In the interest of maintaining sound quality, it's probably best that we keep the video off for now. I can always switch it on if you would like. So in terms of the BCF budget this year, it's £60 million, and it makes up a large proportion of the total funding available to adult social care and community health services. Now, in order for the council and its NHS partners to access the funding, as Chris has touched upon, we have to establish a partnership agreement made in accordance with Section 75 of the NHS Act. Now, these agreements are established every year, normally after the publication of the latest BCF policy and planning guidance. And the guidance normally contains a few changes from the previous year, which need to be reflected in the new agreements. This year is slightly different because central government has not yet published its BCF guidance for this year, and we're already nearing the autumn. So to enable the council to continue accessing the BCF funding in a way that's compliant with the legislation, I've prepared a draft agreement based largely on last year's, but updated to reflect this year's financial allocation. Are there any questions on that before I move on to the discharge requirements? Okay, so on the 19th of March, the government announced the NHS COVID-19 discharge requirements, which local areas were required to implement in order to reduce the burden on hospitals during the pandemic by ensuring that anybody no longer requiring a hospital bed was supported to continue their recovery at home or in a community setting. In order to implement these changes, local authorities and the NHS were required to work together to develop new care pathways and services that were additional to those already in place. The government committed to funding those additional unplanned costs, but mandated local areas to create Section 75 agreements to manage the implementation of the requirements and to access the funding. Now, for many areas, the most effective option for doing this was to create a variation to the BCF Section 75 agreement, rather than creating a separate agreement specifically for this purpose. And that's what we've done for Sandwell. NHS England provided local areas with a template for the variation, which we simply had to customise for our own circumstances before effectively bolting it on to the BCF agreement. Next slide, please, Claire. So in terms of next steps, we're currently awaiting the new BCF policy and guidance for this year. I don't expect to see many changes from last year, but any significant changes will be considered by the Joint Partnership Board and brought back here as required. On the 1st of September, the COVID discharge requirements were replaced by the Hospital Discharge Service Policy, which kind of builds on the discharge requirements, but with a clearer focus on supporting local areas to implement discharge to assess as the usual approach to ensuring people spend no longer in hospital than they need to and are assessed for their ongoing care needs at home or in a community setting rather than in hospital. There is funding available from the NHS to help local areas implement this guidance, and this does include the funding of care and support for up to 6 weeks following discharge while people are assessed for their ongoing care needs, either at home or in a community setting. Now, these arrangements will be in place until the 31st of March 2021, and the current Section 75 agreement presented to you today will be updated to reflect these changes. And that's it from me, thank you. Any questions?
Are there any questions, anyone?
No hands, Chair.
Okay.
Oh, sorry.
Yeah,
Dr. Ian Sykes.
Yeah, it was really just a comment that, I mean, I know we've always done traditionally very, very well, and that's probably an understatement. Regarding a detox or discharge, delayed transfer of care, are we still top of the league? Because I know that's one of the areas where we really excelled in.
Ian, we actually stopped recording detox back in, I think, February time. So February was the last time that we had detox stats, and at that point in time, Ian, we were top of the table nationally for that.
Okay, thanks very much.
Okay, well, that's very good. It actually, apparently we have a recommendation to support the amendments to the Section 75 order to access funds. Are we all happy with that?
Sorry, Chair.
Do we need to take a vote, or do we have any more questions? Oh, we've got some more hands going on.
We've got a hand up from Exec Test 2 and then from John Taylor. So Exec Test 2, Chair?
It was just to let you know that there's a question in the chat from John Taylor, but I think he's now got his hand up.
Okay.
Yeah, thank you, Chair. I'll put the question in the chat function, but basically the introduction was around the Better Care Fund and Section 75 focusing on integration and those most vulnerable. And I just wanted some assurance that BCF is investing sufficiently in the voluntary, community and social enterprise sector to achieve this. And at a later date, could officers share the sort of investment levels in the sector?
Right, do you want me to respond to that one? I mean, we do absolutely invest in our voluntary community sector. We've recently launched the new community offer, which is a multi-million programme over a 3-year period. As far as percentage, I couldn't quote one at the moment, but I can get one for you. But we are absolutely committed to working with our partners in the voluntary and community sector because we value the contribution they make in all of our priorities.
No more hands. Okay, I've got no more hands going up. I'm happy with this unless someone's got any objections. I think that we will support the amendments. Nothing else is happening. No, okay. Thank you. In that case, we will move on to agenda item 4.5, which is the reset and recovery impact findings. And I think that's David that's going to do that for us.
It is, Chair. As you can see, I'm not Sarah Sprung, but I will be assisted by Alison and Leslie. Has anybody got the slides that they can put up? Claire?
Yeah. If I've got them, David, I can share. Oh, you've beat me to it, Claire.
Oh, hi, Sarah. That's the real Sarah Sprung, by the way.
Okay, still waiting. Oh, something's happening.
Sarah, are you able to share them? It's not letting me get control.
There we go, that's looking better.
That's great. Thank you. Somebody's probably still got their mic on. So if you wouldn't mind muting, we're getting a lot of feedback in this room. Okay, that seems to be great. Thank you. So what we wanted to do this evening is just to give you, as a board, a very quick overview of the work that Council has been doing to help us understand the impact of COVID in Sandwell. Now, we know the scale of impact of COVID won't be fully understood for years. It's a constantly evolving picture, as you know. So we've taken a snapshot to understand where we are and how best we can support people now, whilst trying to forecast how needs might evolve. Sandwell's experience mirrors that which is emerging nationally. One of the compounding factors, again, as you all know, is poverty, and levels of poverty in Sandwell mean that our residents have been more vulnerable to both the direct and indirect effects of the pandemic, both for the community and for the economy. And just to make the point, for most importantly, the council has continued to deliver, I think, an excellent range of services for people of Sandwell despite the challenges. And we've done that through a process of reset and recovery. And we're going to skip, I think, onto the next slide. And what you'll see is this is the council's framework for recovery. Much of the work we're going to talk about tonight is the result of our phase 1 activity. That's the area, the chevron in red. And to understand the impact of COVID on our staff, our communities and our economies, we established those 3 working groups, as you can see. For communities, we've got Leslie Hagger and Alan Caddock, our directors, who have been leading work on that. For economy, Alison Knight, and for our staffing, we've got Sue Stanhope. And they've been moving, or they will be moving, through this roadmap of reset and recovery. So we're in that first, that immediate post-crisis response. I know it feels like we should be moving further on, but as Lisa said right at the beginning, we're in as everybody knows, we're in that really difficult phase where we've got a major reoccurrence of the pandemic for Sandwell. So I'm just going to hand over to Leslie. It probably feels like a bit of a race. We're going to try and get through the slides as quickly as we can, so there is a bit of time for questions. So Leslie, over to you, please.
Thanks, David. We're getting feedback. Not quite sure how that.
I think there's probably 2 mics on in exec test 2.
Can you hear me? No.
Yes, perfect.
Yeah, great. Okay. So sorry if everyone's ears just had a bit of screaming sound at them. So the community chapter focuses on the impact on people in Sandwell. It's captured some of the national evidence. It's captured a lot of the experiences of our own staff in the council, but also other people working in Sandwell, particularly voluntary community sector, public health and our neighbourhood teams in the council, and also has captured the voices of children and young people and our own local member workshops. So the evidence that we've seen is, as David was saying, really, what's happened in Sandwell very much mirrors the national picture. So key themes coming out are about mental health, either due to isolation or lack of daily services, provisions, basic things that people need, employment worries, but also being confined, being cooped up has had a negative impact on people's mental health. Food insecurity has been a difficulty. Food vouchers have increased by 188%. That was by early June, and we've seen benefit take up as an issue as well, with that increasing. There's been mounting household debt and also signs of neighbourhood stress, and that's particularly been seen in the increased levels of domestic abuse and increased reporting, so that was increased by 22%, and also the increase in antisocial behaviour incidents, which increased by 50%, and a concern that households are now facing eviction, and the ban on eviction is being lifted, so concern about the future. Our public health survey also identified, one of those issues that's been talked about a lot nationally. So our Black, Asian and minority ethnic population are more susceptible to risk. So next slide, please. In the survey with children and young people, they highlighted lots of lovely things actually, that they were really enjoying spending time with their immediate family, but they missed their extended family, they missed their friends, and young people were particularly talking about their worries about other young people, particularly those children and young people that were shielding, and about the impact on education, particularly for children where they don't have IT access to online learning, or where they're living in challenging home environments where they're not able to work at home. We've seen a big increase in volunteering, people wanting to help each other, but also we've heard from the voluntary and community sector that at the same time that demand has increased, and we've seen the closure of some services and the depletion of services as well. And when we undertook our town member workshops, so finding out what the local population have been raising with local councillors, the themes were the same. Next slide, please. So I'm not going to dwell on this slide, but it really flags up the level of vulnerability of communities and our population in Sandwell. So COVID has exacerbated all of those issues. Next slide, please. And in terms of our overall findings and recommendations, what we know is that our communities living in poverty, living in deprivation, mean that there are already vulnerabilities for our people, but COVID has exacerbated those vulnerabilities, and we need to do something different now to address those underlying vulnerabilities. We've known about them for a long time. We need to do something different to address them, and there are some bullet points there about that. I'm going to hand over to Alison now, who's equally going to whistle stop through the slides.
Thank you. Thanks very much. So, yes, what we looked at was national context and West Midlands context, and also the LEP, and then very local data that we had from businesses. And what you can see here is that it reflects what is happening in Sandwell, reflects the national picture, but particularly in the West Midlands, the prediction is that there's going to be a biggest impact across the area, particularly due to the automotive industry and the supply chain, and been a raft of business closures and redundancy announcements, high levels of furlough also. So moving on to the Sandwell impacts particularly, it's expected that there's going to be 25% of SME businesses closing, We're worried particularly about the impact of furloughing, and I know there's been further announcements this week about how that can be extended, but it still will be a different scheme. There's been a drop in vacancies across the area with a mismatch in skills for those. Definitely been a reduction in jobs across Sandwell, and we can see the picture on some particular maps that we have that we're not showing today, the huge impact in numbers of people now claiming unemployment, and that is before the increase in those people going on to unemployment benefits from the ending of furlough. So digital exclusion, which was mentioned by Leslie, has been a key issue. Many people not having access to IT to be able to reapply for jobs. And we have now more higher skilled people who are going to be applying for lower skilled jobs, which is causing a knock-on effect to those in lower skilled positions. And feedback from Job Centre Plus again reflects some of the other feedback that mental health is a big issue, and we need to factor that in to any of our employment support mechanisms. We've seen, as I say, unemployment has more than doubled during the year, and we've seen a huge increase in universal credit, which has had an impact on our welfare support team. And what we can see here is that we're actually higher than the regional level for people unemployed, lower than Birmingham or Wolverhampton, but still very, very worrying. Moving on to the particular challenges that we've seen on the next slide, a disproportionate impact on young people and particularly lower skilled workers. We already have a low skills base, so we're starting from a lower base, and we're less resilient to actually recover. A bigger impact on older workers. We've seen that the skills and employment support is going to be different, much more focus on digital exclusion and poverty, and also issues around mental health, and also particular issues relating to the economic impact on BAME communities. So going back to David.
Thank you, Alison. So in terms of a summary, if you like, of the whistle-stop tour that you've just had, the common themes that have emerged is around digital inclusion. And as you heard, this is a theme from community and economy. We already have intelligence on the digital needs across the 6 towns, and now it's about turning this into action, accompanied, of course, by the funding to implement. Wellbeing and mental health is a massive issue in the community and for businesses as they adapt and restructure. We also need to support our own staff through change and pressures, and I would imagine that is the same for partners who are sitting virtually around the room. Young people and their skills. Young people have suffered greatly in the crisis, and as we've heard, will continue to suffer as recessions deepen. The council and our partners will need to do more to support young people, and we need to perhaps acknowledge that and work out what that means and the mechanisms to do that. We are going to be working on a new operating model for the council, and that'll be about how and when we work. As partners, it's going to be important for you to know how the council may change in the future. Some things we will need to stop doing, some things we might do less of, and other things we might do differently. Of course, there might be other things that we do more of. We need as a council to think this through, work with our partners if we have got any chance of balancing the huge budget pressures that the council is going to face, not only this year, but for future years. Things will need to be different in the future. It's not going to happen overnight, and as a commitment from the council, we want to keep talking to you as partners about what that means, working with you, engaging with you, looking to the future with you. Lifting collective wealth, we need to address poverty and inequality in our borough and not just treat the symptoms. And this includes our own responsibility as a council to let local contracts and ensure we get social value, we need to implement the community wealth action plan and to work with the community to define and find the solutions. Communication with local people, this needs to be constant and useful, and certainly, as I think has been a theme, certainly in the early conversations today, counteracting misinformation is incredibly important. It needs to overcome language barriers and ensure that we can connect with all of our communities. And these themes and others will take us on to the next stage in the Council's recovery process. Our learning will help with our corporate business planning for this year. It will help refresh the corporate plan and the actions within it, and we're aiming to do that by December. We need and we want this process to reach across the whole of our organisation and to make sure that we work with our partners around the table to do that successfully. From a council perspective, we want to share what we know, and it's important that we understand the priorities of yourselves, our partners, when we develop our plans and consider what the council is going to be doing in the future. Now, we really want your thoughts on this, but it has been a whistle-stop tour tonight, and I don't think we've got time to properly engage, and we've got other members of the team on the call this evening, and our commitment is to find ways to work with partners over the coming months to make sure that we get your views and that you feel engaged and consulted on this process. So very, very quick presentation, Chair. Thank you very much.
Thank you.
Thank you, Sarah.
Thank you, everyone, for that. As David said, a whistle-stop tour of our way forward. I don't know whether anyone's got any questions that they want to raise at this point. I can't see any hands up as we speak. I'm sure that there will be questions that arise in the future, but I'm sure we'll be able to answer any of those, and we'll welcome any input from yourselves. In that case, we'll move on then to agenda 4.6, which is the Black Country CCG merger proposal. Dr. Ian Sykes, please, if you would like to talk to us about that.
Thank you very much, Chair, and I will keep this very brief, and it may be that Michelle can help come in if there are any points that I've missed. I want to bring this up because we haven't formally, well, we've certainly contacted our stakeholders, and one of the slides that I will bring up, actually I've got this slide deck, hopefully Claire, one of the slides that I will show is that we have done extensive consultation. So the consultation regarding this merger started at the end of July, and it formally finished on the, I think it was the 7th of September. We did contact the Health and Wellbeing Board, but for a whole variety of reasons, particularly that the council has been obviously very busy with COVID, we didn't have a formal response, and I felt it was appropriate to bring this up. And I'm going to be very, very brief. So I'm only going to just show a few slides, and it's basically an opportunity for the Health and Wellbeing Board to be aware that we are going through a merger process, and hopefully that the Health and Wellbeing Board can support that. Claire, can you just move back one slide, or is it to slide 4, please?
We only have slide 6.
Okay, right. Okay, so I will maybe talk through some of mine. So basically, what are we going through? So the bottom line is, you're probably all well aware, we have had several stakeholder meetings, and I know that many of you will have actually already attended some of our stakeholder meetings already, so this won't be completely new to you. Part of the STP plan and the long-term plan going forward is that STP, so for those that are listening, that's Sustainability Transformation Partnerships, group of organisations working together. There should be one CCG or CCGs should be coterminous within that boundary, and that's a very powerful expectation. So the expectation is that the Black Country in West Birmingham should be one CCG by the 1st of April 2021. We've our management costs allowance has been reduced by 20%. It's therefore impossible for us to do our continued job, do it properly and remain one single CCG unless we're to consider merging. So therefore we are going through this merger process. That's a merger between Dudley, Walsall, Wolverhampton and Sandwell and West Birmingham to form one CCG, but importantly with 5 distinct places. So the idea is to have the strategic top, that's the CCG, and 5 distinct places. Sandwell would be one of those places, and as some of you will be aware, we have already set up the Sandwell Commissioning Board, a little bit like a mini CCG, which some of you sit on, and we also have the Integrated Care Partnerships, which is more of a provider role, and we have the Sandwell ICP as well. For me, this slide says a huge amount. We are 4 distinct CCGs with some differences. However, this slide shows, I think, that the health inequalities, and ultimately we as a CCG are here to try and commission great healthcare for our population and to try and improve those health inequalities. What this slide shows is that the health inequalities that we face across the 4 Black Country CCGs are essentially almost identical. And I think the second one down, possibly the distinct, possibly the slight exception of Dudley, that's IMD, that stands for the Index of Multiple Deprivation. And you can see from this slide that the 4 CCGs are almost identical. As 4 CCGs, if we have the same health problems, then it makes sense to work together as one organisation and have one plan to address these and not 4. And I think that's the main reason why I think a merger makes total sense. And since COVID has sprung upon us, I think that we've been able to demonstrate how well we have worked as one CCG trying to manage this process. So we have been out to extensive engagement. This will ultimately come down to a GP member vote. Each of the 4 CCGs are going to vote. The vote will take place between, I think it's the 12th and 15th, or the 13th and 15th of October. And if that vote is positive, and all 4 CCGs have to vote positive, then we'll put forward an application to NHS EI and NHS England in Improvement with a view to going through to merger. So it's essentially just to update the Health and Wellbeing Board that as 4 CCGs, we are going out to a member vote to ask for a positive vote that we merge as one CCG to become one clinical commissioning group across the Black Country in accordance to the long-term plan, which I strongly believe is the right thing to do, will hopefully help us to become much more efficient and therefore allow us to invest more resource ultimately in improving the health and well-being of our communities. I think the one important thing to make clear here, this is a merger of CCGs. It is not a merger of anything else. It does not involve patient services or hospitals or merger of anybody else, and it should have no impact on healthcare. I hope that in fact what it will do is improve our ability to commission better healthcare and therefore hope to improve the service we can offer patients. And I'll stop there. I'm not sure if Michelle may want to add anything else in. And if there are any questions, we'll do our best to answer them. And hopefully, I would like to think that the Health and Wellbeing Board would be happy to support the proposal for us to go forward towards encouraging a merger. So I'll stop there, Chair. Thank you.
Ian, Michelle, can I just add a really quick update on that, just to say that obviously across the 5 places, so Wolverhampton, Walsall, Dudley, Sandwell and West Birmingham, our relationships with our local authority remain a real priority, and that's why there's 5 of my posts in terms of that managing director to link in, and certainly my top 2 priorities are 1, support our local GP members, and number 2, our local authority. So you'll still have that local point of contact that links in with you, still attend safeguarding boards, all the things that we do in partnership together, the BCF, that will continue, that local place-based focus will not move. So despite us coming together and having that greater leverage across at scale, at system level, we'll still have those really key local relationships, just to give the board that reassurance.
Thank you, Michelle. Absolutely. In fact, one of the criteria in one of the other slides is that an absolute commitment to make sure that as one larger CCG, assuming that happens, we continue to work with all our local stakeholders, including local authority and Health and Wellbeing Board. So absolutely, yes.
Yeah. Thank you for that. I can't see any hands up for questions. Ian and Michelle, how will this affect Sandwell? Will this affect Sandwell in any particular way? As I say, I'm quite new to this, so obviously my interests are purely for Sandwell at this moment. How will it affect?
I would like to think not. If anything, I would like to think that things would be stronger. So in the sense that you'll have, we'll have these place-based committees. So we'll be one CCG, ultimately with one senior management team for the Black Country overseeing the current 4 CCGs and 5 places. But what we will have is a dedicated team in each place. So therefore, in this instance, it will be the local authority will be working closely with Michelle, because Michelle is our managing director for Sandwell, and she will be dealing and she'll be leading leading a team which will be allocated to Sandwell. So Sandwell will have its own team. I mean, in true terms, it's not actually quite like that, but it would almost be a little bit like 5 mini CCGs within one overall CCG, in order to make sure those close personal links are maintained. And absolutely what we want to do is to make sure that we have got very good local links with our local stakeholders, and hopefully that will be the case.
Okay, thank you for that. Hopefully it will be the case. Okay, well, I can't see any more questions, so we'll make a note of that, and thank you for the update. And we will move on then to agenda item 5.1, which is the board forward plan. Claire Norton.
Yes, so this is the forward plan and the proposed key items for November's board. So if the board sponsors or leads can confirm if they're still relevant and required for that board, or if there are any new proposals that need to be considered. So we have Children and Young People Strategic Partnership update for Leslie.
Yes.
Yeah. We have Inclusive Economy, a further update to the update that we had, I think it was in June, from Alison Knight and Nikki Denster. Yeah. The Sandwell Carers strategy for Stuart.
Yes.
And the West Midlands Safe Centre update for Leslie again.
No, that's not moved ahead.
Okay, so should that be deferred?
Yes, please.
I think Ian Sykes, you've put your hand up.
I have, Chair. I just wondered if we could therefore add in, and it goes along with John Taylor's comment, is whether we could put an item in on maybe update of the CCG merger, because by November we'll know the outcome of the result, whether we put in that application, and we can therefore hopefully give a much more accurate definition of how we propose, or how the Sandwell Place Committee would be developing. So I don't know if it's appropriate just to have an update on how the board has progressed, and we can hopefully therefore answer John Taylor's suggestion, which I think is a very good one, at that time. Thanks, Chair.
Add that in, please.
Leslie Haggard.
Leslie Haggard, have you got a question?
Thank you. Can we please share out the Children's Safeguarding Partnership annual report?
Okay. Can add that in, I'm sure. Is there anything else? Any more suggestions for things we need to add in?
We do also have a list of items that are yet to be allocated to future boards. So if we could prioritise any of those for November, or if they need to stay there for future boards as well. So we have suicide prevention, the cooperative working year.
If we look at those as a whole, and if anyone's got a preference to something that they want to add in, could they put the hand up?
Okay. John Taylor.
John Taylor?
Personally, I'd be really keen, and it could just be a verbal discussion rather than a long paper, to get an update on where Sandwell is with social prescribing.
Okay, I'm sure we can do that. Anything else, anyone?
No, no,
okay, that looks like it then. So those additional items will go on the forward plan for November, which I think is the 25th, the next meeting. Okay, now we move on then to agenda item 6, which is any other business, and we've had something added in here. Rights Equality Sandwell, COVID re-imaging Sandwell Place-based plan. Claire Norton.
Yes, so that's been shared on behalf of Michelle Carolan. So that is the West Midlands inquiry into the COVID-19 fatalities in the BAME community. The report was completed in August with 35 recommendations, and there are 3 that are specifically for the Health and Wellbeing Board to consider. So we have added that as well onto the forward plan for the next meeting for a discussion item. I'm not sure if Michelle wants to add anything to it today, or it was just to ask people to look at the report prior to the next board.
Thanks, Claire. Yeah, it was just to bring it to our attention to make sure that we had the recommendations in hand. So, as pointed out, there's 3 specifically for the Health and Wellbeing Boards at the end of the recommendations list. So, I think it's good if we have it as a further discussion. It's been raised by our patient rep actually on the Sandwell ICP. So I think it would be really good to have a further discussion here at the Health and Wellbeing Board.
Okay, thank you. Anybody? No, nothing else to say? Oh, in that case, we've done rather well. It looks as though we've come to the close of the meeting. The next meeting will be on Wednesday, the 25th of November at 4 o'clock, it's saying here. So hopefully everybody will be able to attend then. So thank you everyone that's attended today. I've enjoyed my first meeting. Hopefully I've not been too bad a chair, and we'll all meet again on the 25th of November. Thank you very much. Appreciate your attendance.
Thank you.
Thank you very much, Chair.
Thanks. Bye.